Welcome back to the Retirement Planning MadeEasy.com YouTube channel. And for you guys that are out there listening to the podcast, welcome as well, where we talk about retirement planning issues, things related to retirement to help you cut through all the noise and focus in on the things that are most important, that are really going to move the needle for you in helping you to have the best retirement possible. If this is your first time here, I'm your host, Chris Hammond. And on today's episode, we're going to talk about Medicare. And I'm going to help you to understand the ABCDs of Medicare. And if you don't know what that is, Medicare is broken up into letters on how they describe everything. Now, you can see on the screen here, I'm going to break down all of these letters here for our podcast listeners. I'm going to walk you through all this so you'll understand this as well. But Medicare has A, B, C, and D. And Part A, Medicare provides basic hospitalization coverage. Part B covers outpatient care, doctor's visits, things like that. Part C is Medicare Advantage, and Part D is prescription drug coverage. So let's jump into this right away. So Medicare Part A and Part B together, that was what was originally in Medicare when Medicare was first created. So when you hear people say the things like, I'm on original Medicare, what they're referring to, or if a doctor says, you need to be on original Medicare or whatever it is, whenever you hear the phrase original Medicare, that means that you're claiming your Medicare benefits through Part A and Part B. Now, Part A, let's break it down a little bit. It provides for basic hospitalization coverage. I'll go into a few of the numbers here, but these numbers, now what we're going over, these are numbers for the year 2023. So these numbers change every year. So I'm gonna read them a little bit quickly here, but they'll be different depending on what year when you're watching this. But for Medicare Part A has a deductible of $1,600 for this year. Now, what that means is if you go into a hospital as an inpatient, then for the first 60 days that you're there, you are responsible for $1,600 out of your pocket. So it's really a deductible. You're going to be paying that out up front. So that's what that deductible is. If you're, heaven forbid, if you're in the hospital for more than 60 days in really bad shape, once you get to days 61 through 90, Part A is going to make you pay $400 per day, and Medicare covers the rest. So you got your first 60 days. Once you meet that deductible, then Medicare's paying for at the hospital after you've paid $1,600 out of your pocket. But if you go over 60 days and you're in day 61 to 90, they're going to still pay, but you've got to pay $400 every day, and then they're going to pay above the rest. Most people aren't going to be in the hospital for 60 days, but just so you know. Then days 91 and later, they give you from day 91 and up, they give you an additional 60 days lifetime reserve there, where you'd be paying $800 per day to be in the hospital for that long after that. So it can get pretty expensive, but I mean, that's kind of a really bad scenario if you're inpatient for that long. Now, they also cover skilled nursing facility care under Medicare Part A. Now, that's not to be confused with like somebody develops Alzheimer's, dementia, or they have to go into a nursing home for the rest of their life. That's not what they mean when they say skilled nursing care. What they mean is if you're having like rehabilitation care that's going on, so you're having to maybe you had a stroke and you're having to be rehabilitated and you're showing improvement and you're getting better, that's what they're talking about under Medicare Part A for skilled nursing care. This all falls under like you can think of Part A as hospital insurance, but it's really like kind of institutional care is what it is, like when you're at a facility, so to speak, staying overnight, things like that. So for the first 20 days, Medicare covers all approved costs. And from day 21 through 100, they'll cover everything, but you have to pay $200 per day for those days. Now, after day 100, Medicare says, we're done, because Medicare doesn't cover long-term care. So if you've ever had a situation where maybe you had some parents and they went into a nursing home, and you may have heard the nursing home administrator say, well, we got 100 days to figure out what to do as far as setting up payment plans or whatever it is, or getting qualified for Medicaid, whatever. The reason they're saying they got 100 days is because they're usually able to work it to where they can get those first 100 days paid by Medicare. So that's all falls under Part A, and hospice also falls under Part A. Now, moving on, Medicare Part B is what when you look at your red, white, and blue card, it'll say like medical next to it. And so it's going to be paying for outpatient care, doctor's visits, things like that. It has a deductible as well for Part B. In 2023, when we're filming this, that deductible is $226. Once you've paid that out of your pocket, then they split the price, where Medicare pays 80% and you pay 20%. So that's how Medicare covers after that. Now, 20% is what Medicare's not going to pay. That's what you're responsible for. So that could be a sizable amount. We don't know what that could be. If you had some type of a surgery that cost $100,000 and Medicare pays 80,000 of it, you might pay 20,000 of it. Just, throwing out numbers like that. So, but it could be a lot. It's an unknown number of what could be out of your pocket. So what a lot of people will do is they'll get a Medicare supplement policy, or also called a Medigap policy, because it's filling in the gaps that Part A and B don't cover. Okay. So a Medigap policy is a private insurance that helps cover these out-of-pockets, like those copays, deductibles, those co-insurance. Co-insurance is like the 80-20 split. That's what co-insurance is. So for a lot of people, the most popular supplement to get today is called a Plan G Medicare supplement. And so a lot of those gaps and deductibles that you heard me say that Part A doesn't cover, like the $1,600 deductible, for instance, or that $400 per day benefit, or $800 per day that you have to pay, the Plan G will step in and will cover that for you. In fact, the Plan G will step in also on Medicare Part B, and it'll pay that 20% for you, so you don't have to pay it. The only thing it won't pay is that Part B deductible. That's it. And that's the thing that was in 2023 is an annual deductible of $226. Once you meet that, then the Plan G is going to kick in and start paying that 20% that Medicare doesn't pay at that point. So that's what a Medicare supplement does. Now, Part A, B, and Medicare supplements, they do not cover prescription drugs that you get at the pharmacy, and that's why there's Medicare Part D for prescription drug coverage. Medicare Part D is actually, it will be through a private insurance company that is contracted and has got approval from Medicare for the policies that they're selling. They have to meet certain criteria. They can't be just garbage policies that they put out there, but they have to meet certain criteria. And a Part D is where you get your prescription drug coverage. So when you go to the pharmacy, you show them that Part D insurance card that you have for whichever company you choose. And there could be, in your zip code, there may be 20 plus different choices of drug plans that you can choose from. And that's what's going to help you pay at the pharmacy. So if you get prescribed something expensive like Xarelto or something like that, then there's going to be some copays that you pay, but the drug plan is going to pick up and pay a lot as well, so that you're not out of pocket as much. So that's kind of when people go on original Medicare and they get a supplement, a lot of times they're going to go ahead and get a Part D drug plan to go with it. If you don't get a Part D drug plan and then in the future later decide to get one, they'll put a penalty against you of 1% for every month that you didn't have one, but you could have had one. They'll put a penalty of 1% against you that they'll tack on top of your premium that you pay for the plan that you finally do get years down the road. So if you go 5 years without a drug plan, that's 60 months. So that could be potentially a 60% penalty that they'll put on top of your drug plan premium. And that penalty never goes away. It stays with you, that you pay it for the rest of your life as long as you have a drug plan. So a lot of people, even if they don't need additional coverage for drugs because they're healthy as a horse, they're not taking anything, they might still go ahead and get a drug plan anyway. It's probably a good idea get maybe the cheapest one out there, lowest monthly premium for that reason alone. Now, the other part of Medicare that we hear about and that I hadn't talked about, because I talked about part A, B, and D, but we skipped the letter C. Well, letter C is Medicare Advantage. And what Medicare Advantage is a private option that combines part A and B coverage. And a lot of times it's offering additional benefits with it as well. So a lot of times you can get a Medicare Advantage Part C with a 0 monthly premium. And the reason you can get it with a 0 monthly premium is because when you sign up for it, you're telling Medicare, I want my benefits that I receive from Medicare to come to me through Part C, through this private company. And that private company will receive funding from Medicare. What would have gone to pay for the Part A and B, they'll funnel that over to the private company. And that private company has to get approval from Medicare to put together a plan that's at least as good as Part A and B. And oftentimes they'll have additional benefits wrapped up in it as well. So they'll have benefits like dental and vision, oftentimes are wrapped in it. Sometimes they'll also, a lot of them they wrap up in their prescription drug coverage inside of it also. So you don't even you can't get a standalone drug plan in a lot of cases with an Advantage plan because the drug coverage is already wrapped up in it. Now, one of the things with Advantage plans, just to keep in mind, is that you want to make sure that before you get one, your doctor accepts the plan so that your insurance is accepted, because a doctor can accept Medicare and take Medicare Part A and B, original Medicare, and may choose not to take an Advantage plan, or they may choose to take certain companies' Advantage plans, but not other companies' Advantage plans. So that's something you want to make sure that you check on so that you can continue going to the doctors that you want to go to. Now, another quick thing that you need to keep in mind with Medicare is that if you are on Part C, then your benefits are coming through Part C, then you should never get a Medicare supplement policy because it won't work as long as you're on Part C. The Medicare supplement policies that we talked about earlier, they fill in the gaps of Part A and B, original Medicare. And if you're getting your benefits through Part C, then the supplement can't work. So if you ever do get a Part C, then there's really no reason to hold on to your supplement. You need to cancel it. And anybody that's talking with you about this, they should know and let you be made aware that your supplement's not going to work anymore if you're on that. But Part C is a good option for a lot of people, and it gives extra benefits that original Medicare does not cover. The big ones being like dental and vision. That's a pretty big benefit. But you'll also hear ads on TV where you might hear things that say, get X amount of dollars towards your groceries each month. Well, what they're doing in there is they're just kind of reorganizing the benefits so that they can give you some money for some other external non-health benefit at all. And usually when people are doing stuff like that, or a company does that, they're usually having to restrict your networks of doctors that you have accessibility to under your healthcare. So you got to really weigh out. Sometimes these things can sound really good that you can see advertised on TV, may not actually be in your best interest. Once you start reading the fine print and seeing which doctors you go to, it might be constricting you on who you can see and who you can't see. It might be making your copays higher. Could be all that. So you got to be careful with that kind of stuff and make sure you're making the right decision. Now, the big takeaway with this, and this is so important because your health insurance is going to be a big, factor in your retirement. A lot of people don't retire until they get 65 because they know they'll be able to get health insurance through Medicare. And it's so important, but you need to really think through how you want to take your Medicare benefits to get the best coverage, and kind of understand how these rules work to make sure that you're not making any mistakes on that. That's all I got for today. If you want additional help with your retirement planning, head on over to retirementplanningmadeeasy.com. Download a copy of our essential step-by-step retirement guide. We don't really talk about Medicare in it, but that's okay. It's got a lot of other good stuff that can help you out getting ready for your retirement. And thanks for watching and listening, and I'll see you guys on the next video and next podcast. Bye-bye.